Good morning, everyone. My name is Abid, working in Algebra Optical as optometrist. And my topic today's discussion is enhancing vision posture in the digital age. So we'll divide normally into two parts. First, we'll speak about the digital eye strain, and the second, we will come to the presbyopia in the digital age. So once we're speaking about the digital eye strain, it's an entity encompassing visual and ocular symptom arising due to prolonged use of digital devices and computer uses. Broadly, the symptom we are dividing into two parts: the ocular symptom and extraocular symptom. The prevalence of digital eye strain as of use of computers and digital devices, it's more than 60% in the adult are experiencing the digital eye strain. And normally the impact of the life is eye strain, headache, and general fatigue, which is affecting the life and normal working condition also. When we are speaking about the ocular symptoms, the first one is coming always the dry eyes. Normally the normal blinking rate per day are usually estimated 14,000 times per day. Computer users and working long time in front of the screens and digital devices, they are reducing their blinking up to 60%. So if we divide it in per minute, so normally it's 22 per minute or 15 per minute, but it's coming 5 to 7 per minute. So what it causes, it's causing operation of the tears and making dry eyes, and in severe cases is going to foreign body sensation and photophobia. The second ocular symptom, which is the accommodation and virtual related symptom, prolonged sustaining the muscles for one gaze, it's causing blurring of vision and headache. Sometimes the worst condition, if you're working a long time in the static position, it's making the difficulty in focusing from one gaze to another gaze. And also in the severe cases, it can cause diplopia. How to improve the ocular symptom in digital eye strain? The first one is 20-20 rule. We know all about this one, that we need to take break after 20 minutes, at least for 20 seconds, and look far. So what it does, it's improve the blinking rate also, and then we are blinking, full blinking. There is partial blinking and full blinking. When we are speaking about the blinking, partial blinking is not helping with the tear, but full blinking is what helping more with the tear, as it's stimulating the glands also to produce the quality of tears. The second, to reduce the glare of the screens. Normally the working condition in the room or optimizing lighting, if you are working in the front of the screen and the light is striking directly the screen, so it's allowing more the screen to face you glare, so you need to adjust yourself for this one. So in this case, you need to adjust the screen and brightness of the screen and avoid the extra light coming from the side. And the final is the lubricant eye drops. You can use the lubricant eye drops and the dry eyes will help it. When we are speaking about the extraocular symptoms, normally it's in the daily routine making inconvenience, headache, stiff neck, general fatigue, and shoulder pain and backache. But this extraocular symptoms are more related to digital age. When we are speaking about the presbyopia in the digital age and correction about the presbyopia, because of the increase of visual demands, when the digital devices are exacerbating presbyopia. Working in front of computers, near task, and the working on multi-screen on the same time, so it's giving you a lot of tough time while using the reading glasses or one glasses. So for that one, it's crucial. The intervention is crucial to find the best correction for that one. Normally, the presbyopia is correcting with the multiple option, which is monofocal, bifocal, multifocal, and progressive. There is an advanced computer office progressive also. If we see the reading glasses are normally designed for the short distance. You need to bend yourself, you need to go closer for the object, or one specific distance you can see the object. But in the progressive, on the other hand, the progressive is giving you distance, intermediate, and reading zone. But the intermediate zone is up on very small corridor, so you need to adjust yourself, adjust your head position, and sometimes you need to chin up for a long time to see the screens better for the long time. So the posture problem, especially the chin up, which is the most common one in the progressive users, they are making their chin up for a long time to support the head. So the neck muscles are forced to work hard to support your head, and then the constant tension can lead to soreness and stiffness and inflammation also. Over the time, the neck joints can become strained, and the discomfort can even spread to the other areas like upper back and shoulders also. The position also compresses the delicate joints in your cervical and spine, adding to the discomfort. Here you can see the reading glasses On my left side, the reading glasses person is going very close and bending the neck and back to see the screen clearly. And on the other hand, if you see the progressive one, so the chin up position, which is she's maintaining the chin up position and finding the intermediate zone to see clearly. So the specialized lens is how we can overcome this, especially for those people who's working in front of multiple screens sometime and more than one screen or multiple tasks. So there is progressive design, also advanced progressive design available, which is giving you more wider corridor for the intermediate and more wider for the reading. But still there is some limitation also. On the other hand, there is computer progressive. Computer progressive is giving you very good quality of vision for the intermediate. As you see as a comparison, in the right side, in my right side, this the progressive, you can see the blue dot on the center. It's giving you intermediate corridor for the intermediate vision. And on the other hand, if you see the blue area in the computer progressive is giving you wider field of vision for the intermediate zone to see clearly without making any posture or poor posture in the sitting position. And you can work a long time with this one easily. Normally, the computer design, computer lenses is designed, they don't have the distance part. It has only intermediate part and then the reading part. So because of the reduced the distance vision, it's giving you more wider field of vision, more comfortable vision, and allowing you to sit relaxed and reduce your poor posture also. They are available in the 3 design normally according to the working condition, need of the individual, in book design, and then PC design, which is designed with the distance as distance you need to work with. So why the computer specific lenses are better? It's more task specific. So it's giving you a bit wider field of vision. At the same time, you can see the intermediate zone like up to 90 centimeter or 120 centimeter. And then the wider field of vision in the sense that you are not moving your head a lot to follow the lines or follow the screens a lot. And then the comfortable posture. This is just a summary of this one, that computer progressive and then standard progressive and single vision. We discussed this already, but this is a short summary for that one. Thank you so much.
Thank you very much for the nice presentation. Any questions?
Yeah.
How do you think they'll be feasible if they have to, do multitask, like, work on the screen, talk to their colleagues? So what kind of lenses do you, advise on these patients?
Actually, the question you are asking about, that if you have distance prescription, and then it will be suitable to give the progressive, computer progressive. Computer progressive is alternative of the distance progressive and alternative of the reading glasses. This is not used. This is not that you can use it for driving. You can use it for outside, but this is only you can use it inside the office, like 4-meter room or 3-meter room. That it's give you more comfortable vision, and you can work for a long time comfortably without any problem. So the distance vision is not there. They remove the distance vision, and it's intermediate and reading zone. But there is no far. This is only until 3 meter. But 3 meter, you will not move your head a lot like this, because the distribution of the power is according to the eye height. When we are taking the eye height, so the eye height is according to the straight vision, like far vision, and then it's gradually coming decrease. So once you are looking through the center point of the lens, like the eye point of the lens, so it will be exactly in the straight on computer. So you can see the computer on the same time. You can speak with someone if you are in the office, or you are speaking with someone. So in the same time, you don't need to remove your glasses as a reading, or you don't need to move your chin up for the computer. It depends upon the what glasses you are using, what is your prescription, and then normally as you can keep stress yourself and comfortable, this is the best position. Not to chin up, not to chin down. Your head, neck, everything. The pressure of the head and the straight is the best position, so it's distribute the weight of the head and the shoulder all over the body, so it's not giving you fatigue.
To give a comment, Thank you very much. I like the lecture. And one thing I don't know if you noticed, he didn't in the stream. Did you notice? He's saying 2020, this 2020 rule, right? He said about the brightness and he said about the lubricants. And he's from Al Jaber Optical. And he didn't mention the blue filter at all. So the debate which we want to raise is the blue filter is doing any help in while you are selling, right? Any help in protecting and doing any decrease in the strain of the eyes as commercially sold.
Sir, I will speak about my experience and my patient that what I'm dealing with. So if we compare the comments of the patient after using blue light protection, I'm not going to the theories, I'm not going to anything, I'm going straight away to the comments of the patient, the comments of the customer, not to make their mind before, just to use in this one. So 70 to 80% of the people, they say yes, we are feeling more comfortable after the using the blue light protection. And this is obvious if you are using like the blue light protection in the glasses or on the screen. So it's helping somehow decreasing the brightness, and you are not facing white light. And instead of that one, you are facing a bit blue filter light. So it's giving a bit soothing effect.
Why you didn't mention it in the lecture if you are that confident about it?
Because this is my personal experience, and there is no lecture, there is no like research or something written that I can give the details for that one. Exactly.
That the literature is totally against blue filter, totally against. And the new studies coming in the last 3 years are giving. The problem is it definitely you are removing the blue side of the rainbow, right? And this is going to definitely make you see clearer and happier on the screen because there are lots of radiation coming, right? But those who are wearing glasses all the time, they have very high reports. They have the research, especially from Australia. They came, if you will come back to the literature, very high incidence of headaches, migraines, convulsions, epilepsy. And for the kids, they are putting the blue filter for the screens. They have very high association now with autism. So people are not, for those who are using the glasses full time, don't put blue filter, please, because all the study, especially for the kids, who are using them just in front of the screens. Yeah, and by the way, there is not even one literature, supporting that the true strain of the screen, there is any protection with the blue filter. One in the literature. And I am debating if anyone will give me one search, give it true one, not a commercial one. So I do respect and appreciate that you didn't mention it. And I think this is very honest. Thank you.
So
we will go for them.
So I will add one thing to your talk, and then I have noticed personally some very rarely, you can say like maybe in 1 year, 2 or 3 patients that we are receiving, and we are giving them blue light, because blue light is not only for computers, it's making the lens anti-scratch and recording everything. So that's why I receive like multiple time in a year 2 or 3 patients that when they are wearing blue light, they are feeling dizzy and they are not comfortable, especially in the night driving. And we did a lot. We changed the prescription multiple times. We changed the eye height multiple times, IPD and everything. At the end, what we noticed, let's try with this one. And once we tried, it's completely resolved the problem. So, but it's very rare. Yeah.
True. Yeah. With the kids, coating is a debate. The coating generally is a debate, and many of the pediatric ophthalmologists, they don't go for coating because of the don't disturb nature usually, and this is the especially during the growing time. Thank you, because we are going to suffer from the time.
Thank you.
No coating for the pediatric ophthalmology. This is a general concept, especially amblyopia, especially squint patients. No coating. What is the general advice 20, 30 years ago? I'm doing basic lenses, but basic which is not available. Of course, many lenses in the market, they are coming with the anti-reflection built in, so you can do, but we are searching for those who are giving a basic lens. Remember that no sunglasses for kids, right? This is what we all learned when we started, because light input is making stimulation, right? This stimulation, any coat is going to decrease the light input, right? So every coat is going to make it a sunglasses somehow. So go for the as much as you can, of course, because the market is not supporting kids.
Especially with the new type.
Speaker, actually.
As I know, there is no blue material available. There is blue coating, and blue coat is in the lemon, no material. But there is two. When we are speaking about the blue light protection, there is two. So once we call it normal blue light protection, which is covering like according to them 420, and then there is, we call it UV 420, which is more stronger to protect the, and it's making the lenses a bit bluish. So maybe this is this one, but otherwise there is no blue lenses.
Thank you very much, Dr. Adil, Abid Ali. And our next, thank you very much.
You're welcome.
Yeah. Our next speaker is Haino. Yeah, our next speaker is Haino Faisal. Is going to talk about the criticalness and the evaluating role of optometrist. Can I ask him to